The National Department of Health and the Solidarity Fund say a down payment of $19.2 million or 283 million rand has been made to GAVI, which is the Vaccine Alliance. This is to secure South Africa's entry into the COVAX facility. COVAX has confirmed South Africa's entry into the facility. For more on this, the Department of Health Director General, Dr. Sandile Buthelezi, joins us now. Very good evening to you, Dr. Buthelezi, and thank you so much for speaking to us.
Good evening, it's a piece of, and good evening to the viewers.
Now, I'm sure the department is happy to be making this announcement, especially with all of the speculation of whether or not you've missed the payments. Does this give you a sense of a sigh of relief that everybody can now get on with the business of the day?
Yes, we are very happy that we finally managed to pay in the deposit into the COVAX facility, and thanks to the Solidarity Fund for coming up and assisting South Africans to participate. We have also been allocated budget by Treasury, which will then take care of the actual procurement when we move forward. The delay was really mainly an administrative glitch that we needed to go through. Unfortunately, as the Department of Health, were bound by the provisions of the Public Finance Management Act, where we needed to work with Treasury to ensure that those are in line so that we are not found wanting when the Auditor General does the actual auditing later in the year. So that was mainly that. We wanted to ensure that we are actually above board in terms of all the processes and the procedures that are required by the Act, because this is actually a procurement process in itself.
So the down payment represents 15% of the total cost of securing access to the vaccines for 10%. I think that's about 6 million of the population. Who will take precedence?
Yes, through the Ministerial Advisory Committee that's got diverse expertise on vaccines, on ethics, on clinical work, on immunology, we've actually developed a program where we've done the prioritization. And the prioritization is really based on the fact that the first batch of the vaccines that we will receive will not be enough to cover all the South Africans. So we will start with those who are at most risk in terms of contracting the virus. Hence, our healthcare workers will be the first on the line. And we then, thereafter, if we've covered the healthcare workers, we can then consider those who are actually the elderly, those with comorbidities, people like with diabetes, hypertension, heart disease, kidney disease, any other diseases that make them more vulnerable and actually get more sick should they be infected by the virus. Then we'll, down on the line, we'll look at the other frontline workers, and then going down as the vaccine gets available until we are able then to vaccinate all the South Africans.
So the country's membership in the COVAX facility ensures that South Africa receives its equitable share of the vaccine once it becomes available. How do you determine how much we need in this context?
Yeah, there is actually an allocation a subcommittee within the COVAX, and we've actually written to GAVI, who's leading on this aspect, that we also want to participate in that allocation so that we are able to see how much we are going to get, but more importantly, also which vaccine in terms of the selection, because as South Africa, again, the expert committee has identified key characteristics of the vaccine that would be suitable for this country. We know that not all the vaccines will probably be suitable for South Africa. So we've put up a key criteria through the Ministerial Advisory Committee that they've advised the minister, myself and the department on what do we need to look at, so that when we sit, we get allocated the right vaccine for us. And those key characteristics that we actually look at, we're looking at one, safety, efficacy, and immunogenicity of that vaccine. We look at the ease of use. By the ease of use and the schedule, I mean, for example, some vaccines need about 2, 3, 4 doses. And for us, ideally, it would be good if we can have just a 1-dose vaccine because it's easy to use. Then people don't have to come back and get the vaccine. The third one is a supply and sustainability. Here, we're really looking at how the supplier can meet the demand. The fourth one is a stability during storage and distribution, and of course the most important being the cost of the vaccine. And as you know, with the COVAX, there's actually a negotiation that is done at a central level by COVAX, negotiation on behalf of all the participating countries. And of course, then the vaccine must be registered with SAPRA, which is our South African Drugs Regulatory Authority.
I want to talk about the human element. It has been said that a vaccine that's tested in high-income countries can't be successful if it's not tested on middle to low-income countries, of which South Africa also falls within this category. What is the importance and significance of this?
Yeah, I think basically what needs to happen is that if we've got the same strain or the same strain of the virus, the vaccine should work irrespective of where it was tested. But also in terms of the conditions, then that's where we then look at the issue of the stability during storage. For example, one of the vaccines that has been registered, it needs to be stored at almost -70, -80 degrees Celsius, which is what we call the cold chain requirements. That obviously in the low-income countries, it might be very difficult to actually get that kind of cold chain requirement of -80 degrees. So those are some of the issues that they are referring to when they look at that. So it is actually important that if the vaccine, if it's tested within the conditions of that country, but not because of the actual virus itself. If the strain is the same, there should be no problem. But then there are other logistical issues which are problematic.
Speaking of logistics, who or what will be involved in the cold supply chain to immunize the population identified?
Yeah, remember that it's not the first time we'll be doing the vaccination. We are actually running a very successful EPI program, which is an extended program of immunization that we use for the kids. But we're doing other vaccines that we've been putting, for example, the vaccines for human papillomavirus for the schools. We'll use that existing infrastructure, but we're going to build on that and see how we actually make it more robust so that we're able to reach as many South Africans as possible. So we'll build on that existing infrastructure as a department.
I wish we had more time, Director General, because I wanted to ask about the legislation behind that, because with what you've just mentioned, it has been argued that you may face some challenges. For instance, you would need questions from parents if parents don't agree that their children ought to be vaccinated. But that's a discussion for another day. Thank you so much for speaking to us. Health Department's Director General, Dr. Sandile Buthelezi.